regular needs such as reproductive age or going through pregnancy, or you have those living with chronic conditions such as your diabetes, hypertension. What we aim to do is to make people live healthier, more fulfilled lives by leveraging behavioral science. So you want to change the way their lifestyle, making lifestyle modifications. You leverage data so that we're evidence-based, leveraging technology, and then also using quality improvement methodologies to ensure that there's continuous improvement. So we do this in 4 ways. We use what we call our patient-centered design approach to address delays in the health system that we have seen. So for example, delay 1 is self-management, being able to manage their care and knowing when to seek care. So we have our flagship product called Complete Health, where members are able to get access. So we don't call them our patients, we call them our members, because they do have their primary physicians, and we just support the care they receive from their primary physicians. So we support our members by providing this platform where they're able to include their health metrics. So their blood pressure readings, their blood glucose readings, their BMIs, and they're able to track their health. But added to that is the ability to engage what we call our multidisciplinary team of coaches. So they get access to a health coach, they get access to a nutritionist, they get access to a fitness coach, an emotional wellness coach. And the idea is that they have a team that supports them on their healthcare journey. They create action plans with their support team, and then they're able to work with that team to ensure that they reach whatever health goals they set up together. This platform is AI enabled, and I will speak a bit more about our chatbot Chem. The second sort of platform we have that also addresses when to seek care is our NaviHealth.ai platform, which is basically a digital patient navigation system where members are able to find health facilities. So they're able to find facilities, providers, but then added to that is the ability to give feedback on the care they receive. The second delay we're trying to address is the cost, transportation, and trust barriers when it comes to seeking care. Complete Health is able to support with this, but then our other platform, the Nudge Hubs, are also a very good way in which we've been able to address this delay. So they're in-person, community-based kiosks within high traffic areas within the country. And the idea is that members are able to go in person. So if they wanted to speak to someone in person, they have this location to go to. They're able to check their health metrics. They're able to speak to someone in person, but then they're also able to benefit from the community outreaches we have and ambassadors that go into the communities to just sort of share a bit more around health education. The third delay to care we're trying to address is receiving the right kind of care at the clinic. So members are able to not only get access to teleeducation sessions, so basically they're held on Zoom, where we get what we call a subject matter expert to not only train healthcare providers in some sessions, but then also provide a way to provide health education for the members that we serve. So by doing this sort of training upskilling, in-service upskilling for healthcare providers, we're ensuring that we can improve the quality of the care they provide to our members and to the people that visit their facilities. Who do we serve? So since inception, we've had over 137 people register on our platform, so engage with our flagship Complete Health platform. We serve people that are living or at risk of chronic conditions, including mental health conditions, so cancer, hypertension, obesity, depression, anxiety, diabetes. We also support women through their reproductive journey. We found that over 37% of the people we serve are women, with 13 of them being men, but we've also found men to be very active in the support that the women in their lives go through. So you have husbands being more intentional about how their wives are receiving care. We've also found that 67% of the people we serve own a smartphone or at least have access to one through their immediate network. So as we've deployed sort of this four-pronged approach, we have sort of align them to addressing certain aspects of the SDGs. So the first one is around 3, which is good health and well-being. We're doing our bit to reduce maternal mortality. They're able to seek care earlier, ask questions that they have earlier, that leads to being able to prevent deaths for both the mothers and their babies. We're working towards providing access to sexual and reproductive health services. Some of these conversations are a bit more private, and so just having that platform and having the ability to ask and engage someone who is a health professional has been quite helpful. We've also been supporting with increasing financing for health, whether it's by empowering the women we serve to be more intentional about their financial literacy, or even partnering with the government to provide subsidies and subsidize access to care. Around quality education for SDG 4, we're ensuring that we're able to provide equal access to quality health education. So whether it's for the members that we serve or even for the health workforce. So through our quality network, we're able to run trainings, right, where members are, where the healthcare provider is able to join, is able to learn from experts in the field. For example, you can have a session on diabetes and pregnancy, and it's a professor from a university college and is able to come and lead that session. But the idea is that by sort of building and upskilling people, you can lead to sustainable development in the long run. We're empowering women, so this is around our SDG 5, gender equality. We're empowering women to be able to use technology. So through our sort of work, we've seen that women are more comfortable with using tech. It's improved their self-efficacy, it's improved their health literacy as well, and also ending all forms of discrimination against women in the healthcare access and delivery. So through one of our platforms, which I'll speak a bit more about, we have been able to give women a voice to give feedback on the care they receive at the facilities. They're able to say what they feel about their engagement with healthcare providers at facilities, and then we've used that to sort of lead through to improvement in service delivery. We're ensuring access to spaces and services that support community health. So our nudge hubs are a way to provide service to vulnerable groups because they're based in rural areas and in some urban areas. So members are able to access care, and also ensuring that through feedback loops, we're able to improve the sort of not only like quality of care, but also infrastructure of the locations in which they choose to seek care. We've also been able to leverage partnerships very strongly, whether it's interacting with the government or development partners, or even the local communities, to be able to ensure that we're not only upskilling, but we're also providing sustainable health system. So now I will just walk through in a bit more detail some of the 4-pronged approach that I had mentioned earlier, and just sort of like the SDGs in which they link to. So we'll start with complete health, where we address SDG 3, 4, and 5. So with complete health, the member, like I said earlier, is able to use this app, both web and mobile-based app, to track their care. So they're able to impute their health metrics very intentionally. So what we do is sort of empower them to be able to do this on their own with the support of a coach. So if you see like my image on the left is a health coach interacting with a member and their support team, and family support team, to just sort of walk through some of the aspects of the action goals they've set up. The idea is that we want people to be intentional about how they see exercise, for example, and what that means for their care, how they're watching the types of meals they take, right? What it means to have a healthy weight. How do you, if you're living with a high blood pressure, how do you work to make certain lifestyle modifications to be able to sort of be at a healthy, a more healthy health reading, right? So we work with their physicians. We're able to make referrals where needed, but we serve as sort of like their first point of call if they needed to seek care ahead of time. We say that we're their health companion, and we are with them 99% of the time they are not with their physician, because we want to sort of serve as their support team through that. And what we found by just sort of walking through this module is that members are able to constantly track and monitor their health metrics, which is contributing to reducing premature mortality, because now we're sort of enabling early detection, we're enabling prevention, we're enabling management of chronic conditions. We're improving access to routine and preventive healthcare services with the regular reminders. So they get prompts, oh, have you checked your blood pressure recently? Have you're up for a conversation with your health coach? And the idea is that through this, we're able to add to the adoption of sustained healthy behaviors, but also improving universal health coverage for people. We're able to, through the multidisciplinary team that they get, sort of reduce the burden of healthcare delivery at the facilities. So if you're able to answer some questions ahead of time, people then don't go burden like the secondary level of care or the tertiary level of care, because they're then being able to more intentionally manage their care. It's also increasing to the health workforce, because we're then providing employment for other healthcare professionals that maybe necessarily wouldn't want to be in the office or other health facility setting, but then they're able to still provide care. We're enhancing equitable access to holistic care by providing member support groups. We're able to empower individuals to take a more active role in their care. Also, just to mention that we technically don't prescribe or diagnose. We're just able to answer health questions and then support them with the care they receive at their facilities. So what we found as we were sort of like running our complete health model is that we started getting, we got our members to trust us a lot more, and based on like the demonstrated impacts they saw, we were getting questions and inquiries round the clock, which our health coaches at some point could not keep up with, especially during COVID, where people couldn't then go into facilities to ask their questions. And so we sort of got together and came up with our chatbot, CAM, which in one of our languages in Nigeria means my own. So the just kind of moving through the idea of getting people to be intentional about their healthcare, their self-care. And so what we've been able to do was initially create CAM as a rules-based chatbot, where people leveraging just the data from interactions within our health coaches and members. But what we quickly found with the rules-based approach was that it had limited conversational and engagement depth. It was not as scalable due to the not being able to handle large volumes of interactions, and simultaneously also given the need to sort of speak the language of the people. So quite a number of people in Nigeria speak English, but then there are over 200 additional languages in the country, right? And then there's also the dependency on sort of like preset or predefined questions. So what we did after that was to go back and sort of think through it again and iterate. And then we came up, luckily we got the Grand Challenges grants, which then helped us in 2003 to run an observational study using CAM and then introducing large language models. Just following the idea of continuous improvement and seeking to improve on our processes. The goal was to improve quality and access. So with what the sort of 2.0 CAM, what we're able to do now is members are able to have very in-depth conversations with CAM. They're able to ask CAM questions around maternal and child health, around reproductive health, around hypertension. They still get the support from the health coaches, but then now they have CAM as sort of like a round-the-clock support. So, but then the loop is still overseen by a team of our in-house clinical team. So they're able to vet the conversations people have with CAM. So I will go in to speak a bit more about our Navi Health platform, which is our navigation system. All right. So with Navi Health, it's basically a geocoded directory where members are able to find health facilities, healthcare providers within their area of locale, so wherever they're based. The idea is we're able to provide transparency and visibility into these facilities, but then they get the added ability to give feedback on the care they receive. So they're able to do go through a rating system, but then they're also able to then type out open text as to the service they receive at the facilities. What we do with the feedback we receive from people imputing is not to name and shame. The idea is not to say, oh, this facility is horrible, please don't go there again, and just sort of spoil someone's business. But the idea is to use that as data and information for quality improvement initiatives. So what we do is then partner with these facilities, these healthcare providers, to say, okay, these are some of the reviews you've received. So this is how we can work with you to improve and be able to deliver better quality service. The reviews people give are vetted. So we have an in-house team that just sort of works through this to ensure that they are credible feedback that has been given. We're very, very intentional about the types of reviews people sort of send in. And so we've based them on a modified version of the 6 domains of quality. So the questions the members get when they go to these facilities is to check whether they felt it was safe, it was timely, it was effective, whether they thought it was patient-centered, the provider was respecting their individual preferences. We also checked to see if, they felt confident that, and comfortable that their information was kept confidential after like a health assessment, and also equity, ensuring that they're able to receive care regardless of wherever they're from, or their ethnicity or location or gender or socioeconomic status. And what we found with navihealth.ai is that people are more comfortable and have gotten more confident in being able to leave feedback. So we've had over 120 patients engaged. We've had over 53 facilities in Nigeria geocoded. We've also been able to capture 21,000 reviews. And what we've been able to do with some of these reviews is also engage the government facilities in, so for example, in Lagos State, we're working with the government there to sort of create a dashboard where they're able to see their feedback very quickly and look at areas of improvement. What we also have that is very key is the care linkage meetings, where we sort of bring together these health facilities to then share some of the feedback we've received and then work with them to create quality improvement initiatives and change ideas that they can then take back to their facilities for improvement. The next platform I will be speaking to is our Nudge Hubs. This addresses good health and well-being, and then also sustainable cities and communities. So what we found in our sort of like interactions and the places we're sort of located is that there was sort of, as you go through the different, sort of pick Lagos State, for example, as you go through the different sort of communities, you see that there's a sort of like a mix of the rural and urban, even if it's a very populous, very forward-thinking states. But then there is some inequities in people being able to access care. So what we've been able to do with our Nudge Hubs was to situate them in high volume select locations. So they're located within or close to marketplaces in Lagos State. And the idea is that we're able to meet people where they are. We're able to get them to, if I was, for example, in my market stalls there selling fabric, for example, I can pop into the MDoc Nudge Hub and just check, okay, I've been feeling a bit, dehydrated lately. I just want to check what my sugar level is, or I want to check what my blood pressure is, or I want to have my BMI checked, right? So they're able to go into these locations that are within their areas of sort of operations and speak to someone. If I have a question, I can go and inquire and get a professional or medical sort of feedback or answers to my question. We're also able to then, through that, sort of reduce the risk associated with non-communicable diseases, but then also in some cases, disease prevention and management. They're able to, like I said, sort of ensure sustainable access to care, ensuring equity, but then also provide spaces within communities where they're driven by the community. We have exercise sessions, and I'll show you some pictures in a few minutes, but you're able to show exercise. We have exercise sessions within those groups. We're able to have nutrition group classes where we're just getting people within the community to be a bit more intentional about their health. So what we found is that our nudge hubs have been able to increase community engagement, health awareness, and intentionality. We have vital screenings there and wellness checks within those locations. So you can see sort of what they look like here and what like our outreach sessions look like. We have been able to serve over 80% of people who are women, and we've been able to, with the support of state government within Lagos State, sort of work to have strategic partnerships that provide access to like health insurance, for example, and healthcare financing for the people that visit the locations. So just to show you a few pictures of what that engagement looks like. So we're able to provide health information for our members. We're very intentional about bonding with the people within the community, where we have, like I said, those exercise sessions where, you know, you don't need to have a dumbbell to move or to get active, right? On Thursdays in the marketplaces, they start a little later during the day. So what we've been able to do is then have these sort of exercise sessions in the mornings, right? When it's a bit calmer, but you're able to use your bottle of water, right, as your dumbbell, so that you're able to exercise. We meet them where they are. We go into their stalls to interact with them, to have conversations and to tell them, you know, just we're in the corner, you can come in and check what we're doing. Then the next platform to just sort of talk through is the MDoc Quality Network, where we address good health and well-being, quality education, and then partnership for the goals. So with MQN, like we call it for short, the idea was to provide a platform where we're able to improve and provide in-service trainings and opportunities for healthcare providers, but then also understanding that there might be a need to empower the people that we serve. So we're able to provide access to essential skills, mentorship depending on the situation, and also with the goal of improving clinical practice and enhancing patient care. The teleeducation design, I'll just speak a bit more about. It runs with what we call a hub and spoke model, where you have like the hub, the center place for engagement, typically, which would be MDoc, but we've also partnered with other organizations to sort of run as hubs. We find the subject matter experts that come and then lead the training, and then we set them up on Zoom. So they last for about an hour and a half on Zoom, including a didactic lecture. So the speaker for the day comes and speaks about a topic, maybe diabetes in pregnancy, for example. So we'll have someone come in and speak on that. But then there's also a case presentation where one of the facilities that are present on the call would present a case that they have addressed, removing all identifiers, of course. But then the idea is that we're able to foster peer-to-peer learning and just like a transfer of knowledge and best practices on those calls. We largely market them on Zoom, largely leveraging social media. So as much as possible, they're as low cost as they come. But then what we also wanted to be able to do is to check the knowledge gained from the sessions. So we run sort of a pre-quiz right before the didactic lecture, just to test where people are in their knowledge of the topic. But then we also do that at the end as well to check, you know, that they have understood or retained knowledge. But then included in that is also like an interactive Q&A session where healthcare providers are able to ask questions about the topic of note. The target audience for our teleeducation sessions, like I've sort of highlighted a bit earlier, is between people living with chronic conditions, women who are pregnant or nursing, and then also healthcare workers of different cadres. So we we run from lab technicians to your heads of departments to the heads of hospitals. The idea is that we wanted to be able to, as much as possible, sort of address barriers to care, right? And as far as it leads to knowledge and practice. And what we found is most of the people we've trained have been predominantly females, and through this, we're contributing to gender equality within a low medium income country. Just to quickly touch on, so you can see an example of what some of those sessions look like. You can see what the quiz that comes up looks like. It just pops up during the session and they're able to take them. But like I mentioned, what we're doing with this platform is to ensure that healthcare professionals get the skills they need. Sometimes it's difficult to leave the facility to go for days to go and run, to go for a program or a training, but we're able to do that on Zoom, right? And we're able to provide them access to what we call CPD points, where they're able to continue their licensure. So it's beneficial for them, and it adds to the sort of their career growth. They're able to learn from people around the world. So some of the speakers we've had or subject matter experts we've had have not just been people based in Nigeria. They've been people based across the world, and we tend to have quite a number of people join from Nigeria, from Ghana, from Kenya, from South Africa, from the US, the UK, just to be able to learn and participate. The last sort of approach that I just wanted to discuss is around how we've been able to use these 4 platforms to just sort of drive partnerships at MDoc. So we've been intentional from our inception to work with a variety of sort of partners in different ways. So we've been intentional about engaging government and policymakers, whether it's state government or federal government within Nigeria, but then also within Ghana as well, because we've had some engagement within Ghana as well, but then also working with sort of like policymakers that we have sort of been fortunate enough to network with. We've also leveraged the private sector, because we know the private sector is sometimes tend to be a bit more organized or have the resources, the assets, the capabilities to be able to sort of make connections to drive improvements, or have skills that are transferable to be able to then share in-house or within the people that we support to drive impact. We've also been able to interact with academia to run studies, observational studies that have led to just sort of tracking our impact and just looking and sourcing for ways to improve. But then we've also been able to then leverage development partners for just being able to expand and just scale our ability to execute within the communities that we serve. One other thing I wanted to quickly touch on as we just sort of like round up is our use of QI methodologies. So one of the things we've been intentional about from inception is sort of leveraging QI to continuously improve within and foster a culture and platforms of continuous learning within MDoc as a whole. So how our staff interact, address problems on a daily, and even interact with the members. We run sessions such as like our brown bag series, which are run once a month, and basically are interactive workshops we have in-house for, so basically we identify gaps within the organization that or in our processes that we want to sort of improve on, and then we get members of the team, or in some cases external members, to come and sort of give trainings on that. So sometimes it might be around understanding data a bit more, it might be around using agile processes a bit more and methodologies a bit more. We have what we call journal clubs, which are held bi-weekly, and the idea is that staff members are able to go find research on things that are similar to what we do, or ways, you know, or best practice ways that we can improve on. So they come, they present, and then as a team, we just sort of identify areas of similarities or things that or techniques that we can use to improve on. The idea is that we want our people to be curious, our staff members to be curious, to also seek to improve and get better as we deliver on our mandate. We do run clinical audits where we assess cases that we review cases of member-coach interactions. And the idea is that we're able to look at areas of improvement, what we did well, what we could improve on, what we plan to sort of adapt in our sort of clinical effectiveness and patient care. We run PDSA cycles across the different teams, and the idea is that our staff members are able to think through change ideas that they can implement, the target areas of improvement, and then work with the support from the quality and learning team. So it's a large part of what I do at MDoc, support them in making improvements in that service delivery process. We run Gamba walks across our different notch hubs and also within the our areas of focus, doing shadowing calls as well, where we're just looking to same sort of like focus or outcome, looking to identify areas of improvement, and also like working with teams to just sort of implement those areas of improvement. We also then connect our staff members to what we call self-paced learnings, where they're able to interact with, for example, we have a partnership with the University of Washington where staff members are able to, and then we've also been able to open it up to even our network. So whether our partners that we've engaged with in the past are just looking for a way to upskill within their areas of focus. And so we've been able to run sessions around monitoring and evaluation, you know, checking how initiatives are adding value, and the impacts we're sort of able to record, but then also around project management as well. So ensuring that they're sort of working towards being efficient. Some of the impacts we've been able to sort of realize is our support for saving maternal lives, neonatal lives, are also supporting people living with chronic diseases and conditions. Our members have recorded sort of like a decrease in their systolic readings around hypertension, but then also fasting blood glucose reduction as well for our members living with diabetes. We support women with their reproductive health services, over 100,000 women, and we have seen that our members who were living with depression and anxiety have been able to see an improvement in their overall health. We've been able to train over 13,000 healthcare workers using MQN on Zoom, and then also reductions around their BMI. But I think one of the very key sort of health outcomes that we've been able to record is improvement in self-efficacy for the people that we serve, just that into being able to be more health literate, and just kind of confidence in being able to take charge of their health and be intentional about seeking care. We have also been very intentional about how we've leveraged data and how we disseminate the evidence we sort of garnered from our work. And we've had the opportunity to present at several conferences across the globe, quite frankly. And then also we've also contributed and written peer-reviewed publications in notable journals as well. So your BMC, BMJ, Mayo Clinic as well. And just basically the idea is documenting and showing sort of the impacts we've been able to generate from our work. Moving forward and sort of building what we're striving to do sort of in our future is to be able to refine and harness our AI chatbot and sort of like the service we provide on Complete Health, being able to sort of serve new markets and existing markets within the African continent. We are looking to strengthen partnerships with global health leaders and government to drive and amplify our impact, just working towards advancing our digital health infrastructure, using AI to drive insights and decision-making, and then continuing to just sort of be more evidence-based and just sort of contribute to a growing body of research across the world around how you can continuously improve and how you can deliver impact to the people we serve. So that is it. Thank you so much.
Thank you, Olabisi. This is fantastic. This was a real great presentation for all of us to hear. Just as a
Thank you.
context, I would like to tell you that the startup that I have with a few colleagues of mine is at the Indian Institute of Technology in Delhi, and it is called Equality, Equity, and Inclusiveness in Healthcare. The fundamentals on which we run this startup are 3 T's that we call technology, teamwork, and trust. Trust with the
Nice.
community. And,
Yeah.
you know, after this call, I'll surely be in touch with you because there is so much to learn about how we can leverage technology to really build a teamwork and also trust within the community by increasing the acceptance of these technologies for their healthcare. And I'm sure that there'll be a lot of lessons that we can learn, but that is a separate conversation that we will have. I'd like to really now open up. We have about 10 minutes for the audience. If you have any questions, and if someone helps, get the questions from the chat box, it'll be wonderful. But please feel free to have any questions on this excellent work that is being done in Nigeria. So one question that I had, is this beyond Nigeria also that you work, or is it limited to within the geography of Nigeria?
So we have started to expand our work. So we have some of our sort of like, would you say, from our 4-pronged approach in Ghana, like I mentioned, in Kenya, and then we're sort of entering other African markets, so in SA, and just sort of working through that.
Excellent,
so,
excellent.
But largely our base is in Nigeria.
Because I had the privilege to work with an organization in Nigeria called Nigeria Health Watch. They work on the social mobilization and communication. So that has been a wonderful team, and I'm sure that we will have opportunities to connect in the future. But I would really like...
We have had engagements with them as well, and just sort
wonderful.
of being able to just sort of share our impact.
Excellent. My trip to Nigeria was when I was at the Gates Foundation for the polio work.
That was great work. That's right. Just working through.
So any questions from anyone? We'd be very happy to take questions if anyone has a question.
And I just wanted to say, like, thank you for all the feedback. I just reading through the chat now. So thank you so much for all the feedback on the work. I think it's helpful for us to just sort of get that what we're doing is, is making sense, and it's improving the health. Absolutely. Just doing our bit to improve the SDGs as well. Thank you all.
Yeah. The CAHO team members are very well connected to the community, and we continue to seek learnings about how we can connect with the community better and make it a very people-centric healthcare. So thank you. This presentation was very helpful.
Thank you.
Ma'am, if you can unshare your screen, please.
Okay, yes, I will do that.
Yeah. There is a question which has come is, what are some of the biggest challenges in adopting the healthcare applications in rural regions? And I believe she means about rural Africa and Nigeria. Yeah.
Thank you so much for that question. So largely it's about just even knowledge, right? And that's why one of the things we've sought to do is just sort of build people's digital literacy, right? And a lot of what you find is people sort of tend to stay away from it. But what we have done instead is to say, it might just take 1 minute to learn how to use your device a bit more, and you're able to then impute your health, and it doesn't then seem as big a challenge as people would think it would be. And that's why our nudge hubs have been very helpful, right? That people can go in there, they can actually speak to someone. There's a tech whisperer that can support them through like registering and just adopting tech, which is typically would be the sort of blocker, but we're not seeing it as a challenge. We're instead seeing it as just an opportunity to share health, right, and get people more intentional.
Yes. Yeah, also in our India work in the digital application technologies, we have found 3 A's that we call are the major barriers. One, you rightly mentioned about awareness. The second is about access, because there are, very limited access to these kinds of sophisticated applications in certain parts. But there's a third area about apprehensions, about, the data sharing, the loss of the privacy of the data and all of that. So yeah, awareness will break a lot of those taboos probably, but access is also a very important issue for us in rural areas.
And just to add that's where the trust comes in. So it's being able to get people those apprehensions of sort of their data is quite important.
Yes, very, very important. So I think we had a lovely conversation. We are close to time. Any other questions? One question, have you ever visited India?
No, but I would love to.
You are most welcome. We'd be very happy
my
to
gosh,
host
I
you
would
sometime.
love to. I've been watching the movies and dancing, and I absolutely love Indian food. I'm actually everybody in my family is out, so I can't wait. I hope I do get to visit soon.
Absolutely. And we'd be very happy to also host you when you are here. Do let us know.
Definitely.
But sometimes probably during a little bit later part of the year when it is a little cooler in India.
Okay. No worries. It's actually pretty hot here.
But do come to India sometimes. Wonderful. Any other questions from anyone? Excellent. So I would like to now hand over to the CAHO Secretariat.
Thank you very much for the wonderful session. And with this, we would come to the end. And I would invite Dr. Raj Shankar Ghosh to hand over the certificate of appreciation. So this will come to you via email, ma'am. Yeah.
Honored and privileged to do that. It was really a wonderful session. Thank you. A real appreciation from all of us to you. Thank you very much.
Thank you.
Thank you, ma'am. And the certificate, along with the screenshots of today's program, will reach you via email. Ravina, next slide, please. Our next session is on surgical patient safety initiatives. So kindly join for the same and look forward to, this is our ISQua fellowship. The discount code is CAHO 2024. With this, if you want to enroll for the ISQua fellowship, you will be getting a discount, and that's a 10% discount that you will be getting. Please get the maximum out of it. And friends, I would like to invite you to the most exciting CAHO-Con, which is scheduled for 12th and 13th of April at Delhi. And before that, on 11th April, we have 20 pre-con workshops happening all across Delhi. Kindly register for that. This is happening at Hotel Pullman Aerocity. Block your dates and see you all there. Have a wonderful evening. Thank you, everyone.
Thank you. Bye-bye.
Bye.
Take care.